Hello everybody, welcome to Living La Vida Longer. Here you will find the secrets to increasing lifespan and longevity. Every year, millions of people around the world suffer from heart attacks and strokes, two of the leading causes of death globally. While many are aware of common risk factors like high blood pressure, high cholesterol, smoking, and sedentary lifestyles, there are several lesser-known contributors that also play a significant role in cardiovascular health. By recognizing and addressing these hidden dangers, individuals can better protect themselves and improve their overall well-being. But first, make sure to subscribe to the channel so we can help you live a longer, happier, and healthier life. With that being said, let's discuss 6 hidden causes of heart attacks and strokes that everybody should know. At number 6 is alcohol and substance abuse. Excessive alcohol consumption and substance abuse are significant contributors to the risk of heart attacks and strokes. While moderate alcohol intake may have some cardiovascular benefits, excessive drinking can lead to cardiomyopathy, high blood pressure, irregular heart rhythms, and increased triglyceride levels, all of which elevate the risk of cardiovascular disease. Chronic alcohol use also contributes to obesity and diabetes, further compounding cardiovascular risks. Similarly, recreational drug use, including cocaine, amphetamines, and opioids, can have detrimental effects on heart health. These substances can cause cardiac arrhythmias, heart muscle damage, and increased blood clotting, significantly increasing the likelihood of heart attacks and strokes. Reducing alcohol consumption to moderate levels and avoiding recreational drug use are essential steps in protecting cardiovascular health. Coming in at number 5 is sleep disorders. Sleep disorders, often overlooked, play a crucial role in heart health. Conditions such as sleep apnea and chronic insomnia significantly increase the risk of heart attacks and strokes. Sleep apnea, characterized by repeated interruptions in breathing during sleep, leads to low oxygen levels and increased blood pressure, both of which strain the cardiovascular system. Chronic insomnia, the inability to sleep adequately, contributes to sustained stress, elevated blood pressure, and inflammation, further escalating cardiovascular risks. Studies show that poor sleep quality disrupts the body's natural processes, impairing its ability to repair and maintain heart health. Furthermore, inadequate sleep affects the regulation of hormones related to appetite and stress, leading to unhealthy lifestyle choices like poor diet and reduced physical activity. Addressing sleep disorders through medical intervention, improved sleep hygiene, and lifestyle changes is essential for reducing the risk of heart attacks and strokes, ensuring a healthier, more resilient heart. At number 4, we have mental health issues. Mental health issues such as stress, depression, and anxiety are significant but often hidden contributors to heart attacks and strokes. Chronic stress triggers the release of stress hormones like cortisol and adrenaline, which increase heart rate and blood pressure, placing extra strain on the cardiovascular system. Over time, this can lead to hypertension and damage to the arterial walls. Depression and anxiety can be linked to poor lifestyle choices, including unhealthy eating, physical inactivity, and substance abuse, all of which further heighten cardiovascular risk. If you have struggled with mental health, what are your favorite techniques to help you feel better? Leave a comment and share your wonderful advice with the Living La Vida Longer community. Individuals with mental health conditions are less likely to adhere to medical advice and treatment plans, exacerbating existing health issues. Research indicates that the inflammatory response associated with chronic mental health issues also contributes to arterial damage. Addressing mental health through therapy, medication, stress management techniques, and a supportive social network is crucial for maintaining heart health and preventing heart attacks and strokes. Before we continue, here's another video on high blood pressure you should consider. Watch 5 foods to avoid with high blood pressure, hypertension. Now back to our discussion on 6 hidden causes of heart attacks and strokes that everybody should know. Coming in at number 3 is air pollution. Air pollution is an often underestimated risk factor for heart attacks and strokes. Fine particulate matter, PM2.5, nitrogen dioxide, and other pollutants can penetrate deep into the respiratory system, entering the bloodstream and causing systemic inflammation. This inflammation damages blood vessels and accelerates the buildup of atherosclerotic plaques, leading to narrowed arteries and increased risk of blood clots. Chronic exposure to polluted air can lead to hypertension and oxidative stress, further contributing to cardiovascular diseases. Studies have shown a direct correlation between high pollution levels and increased hospital admissions for heart attacks and strokes. Vulnerable populations such as the elderly, children, and those with pre-existing health conditions are particularly at risk. Mitigating the effects of air pollution involves both personal and community actions, such as using air purifiers, avoiding outdoor activities during high pollution periods, and advocating for cleaner air policies. At number 2, we have vitamin D deficiency. Vitamin D deficiency is a hidden but significant factor in the risk of heart attacks and strokes. Vitamin D plays a crucial role in maintaining cardiovascular health by regulating blood pressure, reducing inflammation, and ensuring proper function of the endothelial cells lining the blood vessels. When vitamin D levels are low, these protective mechanisms weaken, leading to increased arterial stiffness and higher blood pressure. Studies have shown that individuals with low levels of vitamin D are more likely to develop hypertension, atherosclerosis, and other cardiovascular conditions. The deficiency can also contribute to increased levels of parathyroid hormone, which is associated with arterial calcification and cardiovascular risk. Ensuring adequate vitamin D levels can be achieved through regular exposure to sunlight, consuming vitamin D-rich foods like fatty fish and fortified dairy products, and taking supplements if necessary. And finally, at number 1 is chronic apical periodontitis. Chronic apical periodontitis, a persistent inflammation of the apex of a tooth's root due to bacterial infection, is an often overlooked risk factor for heart attacks and strokes. This dental condition, typically resulting from untreated cavities or dental trauma, can lead to a continuous inflammatory response in the body. The chronic inflammation and bacterial presence associated with this condition can cause systemic inflammation, contributing to the development and progression of atherosclerosis. Research indicates that the bacteria and inflammatory mediators from chronic apical periodontitis can enter the bloodstream, leading to endothelial dysfunction and promoting the formation of arterial plaques. These plaques can narrow arteries and increase the risk of blood clots, precipitating heart attacks and strokes. Maintaining good oral hygiene, regular dental checkups, and timely treatment of dental infections are crucial for preventing chronic apical periodontitis and protecting cardiovascular health. Addressing oral health proactively can significantly reduce the risk of serious cardiovascular events. Understanding the hidden causes of heart attacks and strokes is crucial for effective prevention. By addressing these hidden risks through lifestyle changes, regular health screenings, and proactive healthcare management, individuals can greatly reduce their risk of cardiovascular events. Empowering ourselves with knowledge and taking proactive steps towards a healthier lifestyle will not only protect our hearts but also ensure a better quality of life for years to come. Please note that this video is for educational purposes only and not intended as a replacement for professional advice. Remember to consult with a healthcare professional before making significant dietary changes, especially if you have existing health conditions. We hope you gained a ton of knowledge from this video. Don't forget to share it with everyone you care about. Thank you for watching and see you in the next video.